Welcome to Cura Talks, a podcast by Cura Health that brings you thoughtful conversations with healthcare professionals across Kuwait. From wellness myths to modern medicine, each episode gives you the insight and clarity you need to better understand your health and your choices. In this episode, we're talking about the rise of cosmetic dentistry in Kuwait. From TikTok teeth whitening trends to the growing demand for veneers, are we chasing the perfect smile at the cost of long-term oral health? Joining me today is Dr. Liddawi, Cosmetic and Restorative Dentist, who's here to help us separate fact from fiction when it comes to dental aesthetics and health. Dr. Raja, welcome to the show.
Hi.
So let's start with what's on everyone's For You page. Whitening strips, LED kits, miracle TikTok hacks. With all of these at-home whitening trends going viral, are we damaging enamel in the name of aesthetics?
Well, the short answer is yes, because when you get these things done professionally, you're supervised by a dentist. So they know exactly what percentage of bleach to give you, how long you should wear the bleach for. They control the excess so that it doesn't touch your soft tissues. But a lot of these home kits and trends that people do at home, they're doing it in an uncontrolled environment. They don't know how long they're wearing the bleach or what type of bleach is being used in the first place. So they're getting a lot of sensitivity, a lot of dental pain, and they're getting a lot of soft tissue burns. I'm sure people at home have tried doing it and then they notice that their gums go white. And when you bleach your gums, if you do this over the long term, it's actually you're burning the gum, it's damaged, so you might end up with recession and other issues. So at the dentist, they'll examine your teeth first, make sure you're healthy, and then offer you the bleaching if you're a candidate. If you have a crown in the front and you go at home and go get your bleaching done, that crown's not going to change color. It's synthetic. Your tooth is going to change color. So everything's going to be white and you're going to have one yellow crown in the front. Or you have a lot of fillings at the bottom or decay. You're going to cause a lot of pain. But it's always better to get it done professionally and not a quick fix.
Are there any trends that you actually support then?
I watch a lot of these because it's interesting for me. So I've seen everything ranging from like people filing down their teeth with nail files to brushing with abrasive toothpaste, like time-lapse style. And I don't. If someone promises you something quick, there's a big question mark. Just know that.
Right. Well, the obsession doesn't stop at whitening, right? So why do you think so many people here in Kuwait are skipping braces and going straight to veneers, even when their teeth are perfectly fine?
I personally think it is a trend, so they're going with the hebba, but I think they don't want to wait. People want a quick result. They don't want to go through a year of braces or 9 months of braces. So it's a shortcut, basically.
Yeah.
And I'm not for shortcuts because even though you can get it done, it goes against the philosophy of being minimal and trying to be conservative. So let's picture this together, okay? You've got some teeth in a row, and we're going to get nice veneers on each, okay? If I have a tooth that's so pushed forward that actually needs to be moved back, how am I going to achieve a final result without drilling all that excess of the tooth? So by drilling all that part of the tooth that's stuck out, I might reach the pulp, you might need a root canal, but your teeth were fine in the first place. You straighten things out first, and then you assess with the patient if they need cosmetic work or not.
So I know that you dub yourself as a conservative cosmetic dentist. Tell us what that is. What is being conservative?
It's most of what I do is restorative dentistry. So I want to bring back function, and it's all about health. Cosmetics are add-ons that come in at the end, but your main goal is to bring back health and function. So by being conservative, you kind of try to be as minimal as possible. If the teeth are fine, you might offer a solution that's more simple, like a dental bleaching, if they're in position and they're nice, or some composite bonding where you add tooth-colored material to the tooth to change the shape without drilling the tooth. So it's kind of reversible as well. But I always tell the patients that there's no going back, right? Your enamel does not regenerate. It's not like a nail or hair. If it's gone, it's gone. So they have to know all these points before going for something that's irreversible, basically.
Right. So have you seen patients come in wanting cosmetic procedures when actually all they need is just orthodontic work?
100%. It happens a lot. And then it's your job to sit and try to convince them or show them at least. So what we do nowadays is I can even see we scan the teeth, okay? And we get a nice digital scan of the teeth, and they can actually visualize what the teeth are going to look like before they even decide to touch a tooth or get their ortho done. So then when they see that simulation, in a way, I'll be able to convince them, like, look how beautiful they are. You don't need to drill the teeth. And then they start asking other questions like, how long is it going to take, blah, blah, blah. And that's how you try to convince people not to go for the quick fix.
Yeah.
Do it properly.
Yeah.
Yeah.
So let's talk about influence then. So from before and afters to sponsored dental clinics, are influencers really showing people the whole truth about cosmetic dentistry, you think?
The results are real, but there's a lot of behind the scenes stuff that happens that is not actually shown, you know? The amount of tooth structure that's been drilled away, or the amount of teeth that were removed, or the implants that were placed, or so take it with a pinch of salt.
Yeah. I mean, if you drive down any main road in Kuwait, every other billboard is telling you that you need to change something about yourself, your body, your face, your teeth. What's your take on that as a cosmetic dentist?
Your skin, your body, your face, everything. Yeah. It's like back in the days, magazines, you know? And like I said, it's a trend. Go for something timeless. And I think you should self-love. So a lot of the conversations you have in the clinic is not only about results. It's about you sitting and talking to the patient and explaining to him that it's beautiful. It gives you character, you know?
Your flaws, you mean? Your flaws.
Yes, of course it does.
Yeah.
It's like a fingerprint. You don't want to be a cookie cutter like everyone else in that box. Like we're all the same. We're all dressed the same. It's not nice. It gives you uniqueness, you know?
So part dentist, part therapist is your job, I think.
Of course. Okay. Embrace the uniqueness.
Right. Yeah. Okay. Let's be honest then. Veneers come with a lot of behind the scenes work, you mentioned. Shaving down natural teeth, replacements every few years, the maintenance. If people saw that side of it, do you think they would be so quick to sign up?
That's why before these procedures are done, you go through proper informed consent. You have to sit and explain the pros and cons of anything. It is a trade-off, but certain people are good candidates because they've had a lot of work done in the past, or they've done veneers in the past, so the shaving's already done, or the teeth were badly broken. So those are kind of the good candidates for that procedure. Yeah. But if someone comes to me with nice, healthy teeth, I don't think it's worth it.
Yeah.
So you try to convince them to embrace that.
So what's one trend then that you've seen really damage people's oral health, even though they thought they were doing something positive?
One? Well, I've got a lot. Well, I've seen one where they actually get nail files and try to shave down the teeth to shape it nicely. But that's insane because the damage you're doing is, like I said, you cannot regenerate this enamel.
You talk about trends. I've been seeing this thing called turkey teeth. Tell us more about that.
Turkey teeth. Oh, you get all sorts of teeth now. You get turkey teeth. You get other countries. I'm not going to mention.
What are turkey teeth?
Turkey teeth. It's like, I'm sure you've seen them online. I want you to go and like just type in turkey teeth and see. You remember we were talking about that chiclet look?
Yeah.
It looks fake. Now that was a trend back then. People wanted that. But when you look underneath those teeth, because I do a lot of changing them, you notice that they're like shark teeth. So if you've ever seen a shark's teeth, they're really drilled down. It's a very extreme, aggressive.
That's the final look, or is that what they have to do to get a...
That's what they do to get that nice final look. Because keep in mind, with turkey teeth, you're traveling. You're traveling to get your teeth done and come back. You don't have 6 months of braces, 9 months to wait. You're getting a fast result. Right. So you've got a week to get them done, or 5 days. Even though, remember we spoke about at the beginning how if your tooth is pushed out, I need to drill more?
Yeah.
That's the concept. So they have to drill more to bring them into the position they want so that the ceramist can get some nice results.
Is that specific to a country?
No,
or could this be done?
It's just a saying. They say turkey teeth because they do a lot of offers and flights, hotels. Get them, but they get that in other countries too. You know, that they get it done for a lower cost and they just want to get it done quick. But it's about the quality work, not the price, I think.
What about, so I've seen you do work on, like funky work on people's teeth. Tell us more about that and what's your take on that?
Funky work, like customized designs.
Yeah.
Yeah. It's different. Like, see, I don't see them as my patients. They're my people, right?
First of
And
all,
I have
tell
to
us
gauge.
what is custom work?
Custom work is people come and ask for the most random things or something that they might have seen on someone else that might have suited them, but it wouldn't suit your face. Do you know what I
So
mean?
what's the craziest custom work you've done?
I've done a few, but those people are coming for that reason, you know. But it's in, like, in our society here, the usual things people ask for are, they wanted the bunny smile for a while with the front two teeth
Yeah.
that are longer, but that's kind of been fading away because it was a trend as well. But I get some custom work. Like, I once got some vampire teeth that were done. It was a beautiful result, but I wouldn't do that for anyone. It's
So you vet the patient to make sure that
Yeah.
they fit the bill.
We sit and have a talk first, right? So if you want to go and get a nice dress fitted or made, you're going to tell the designer what you want.
Yeah.
But your designer is going to tell you, listen, for your body shape, maybe try this cut or try something else. So we're doing something together. We're cooking something together. You give me your 2 cents and what you like, and I'll give you my 2 cents and what I feel is right. And we build something together.
So if I come to you and tell you I want vampire teeth, you could reject me, but if you think that I fit the bill, then you would do that work. Is that what you're saying?
I'll initially tell you it will not suit your face. We'll do a mock-up. I'll actually let you do a try where you can try the teeth before me even touching them.
Yeah.
So I'll give you the vampire teeth to look. And then I'll need to know a lot more. You know, is it your lifestyle?
Yeah.
Do you really think about it? Or did you just think about it last week and come to me? So for that kind of work, I actually would tell them to think about it for a few months. And then they can always come back and get it done. So I'm not running away, but be sure of what you're asking for. And
Yeah.
if it's the right thing, then yeah, we might go for it.
That's interesting.
We might not, though.
If you could tell every patient one thing before they commit then to a fast smile makeover, what would it be?
Maintain your natural as much as you can until the wheels fall off. And then when the wheels fall off, I'll get you a solution, basically. Okay? So try to maintain what you naturally have, because nothing's better than what you have. It's God-given, it's natural. Khalas, this is the best. I can't come and tell you, well, zirconia is better than enamel, or the ceramic we use is better. Nothing's better than what you naturally have. So if your teeth are natural and good, then no, you wouldn't touch them. But like I said, if they're badly broken and they have issues, then of course we're going to go for restoring them, because you're going to protect them. So imagine this room is a tooth, and I have 1 wall gone, 2 walls gone, 3 walls gone, and all of it is a nice synthetic filling, and all we have is 1 wall left. On use over time, this last wall is going to break. So in that case, yes, I will crown it for you to protect it and hold it together.
Yeah.
But it's case selective, basically.
So do you think then the next trend is going to be the reversal of all of this cosmetic work back to natural smiles, long-term health, and less shaving and shaping?
This trend's been going on, I think, for the past 3 years. I've noticed a lot of people that were with the trend of getting veneers back in the day, they wanted really white teeth. Like, I mean, paper white. Chiclet teeth, yes. And that was a trend back then. So a lot of people are coming now wanting to reverse that. Now, because the damage is done, and like we talked about, the enamel doesn't regenerate, they're changing their veneers to something more natural, something that's more translucent, the whiteness that would suit their skin tone, and something that would not look like, oh, ashkaram sawi asnana. No, it's more like, oh, you look good. What did you do? We don't know.
Yeah.
You want to keep them confused. That's the balance.
And so you're saying, have you already started to see that shift here in Kuwait?
It's a lot. For the past 3 years, I've had quite a few. A lot of those, actually.
Okay, so this has been such an eye-opening conversation. At the end of the day, we all want to feel confident. We all want to, look good, feel good in our skin. And there's a big difference between, what looks good on Instagram and what's truly just healthy for you. So to close, if there's one thing you hope people could take away from this conversation, one message you'd want echoing after they scroll past the next dental trend, what would that be?
If you find a trend online and it's promising you the world, there must be a trade-off. And that trade-off is usually your health. So maintain your natural teeth as much as you can, because there's nothing better than natural. And if that fails, then we'll get a solution that's going to be right for you cosmetically. Thank
Thank
you.
you, Dr. Raja.
Same as it.